Hello. Welcome to our channel. Did you know that considering the signs of a stroke can save a life? Every second counts, and acting quickly can make all the difference. Today, I'm going to show you the 6 main warnings that you need to know to identify a stroke and act at the right time. Stay with me until the end, because the information you will learn could be decisive. Cerebrovascular accident, known as CVA, is one of the main causes of death and disability in the world. This occurs when blood flow to the brain is interrupted, either by a blockage in an artery, ischemic stroke, or by a leak or burst blood vessel, hemorrhagic stroke. When this happens, brain cells begin to die due to lack of oxygen and nutrients. The consequences will be devastating, but considering the signs and time can save lives and reduce the consequences. Here are the 4 main signs you should know about. 1. Weakness or numbness on one side of the body, a crucial sign of stroke. Sudden weakness or numbness on one side of the body is one of the most common and important signs of a stroke. This symptom occurs because stroke affects a specific area of the brain responsible for controlling movements and sensitivity on one side of the body. Because the brain operates cross-functionally, a problem in the right hemisphere usually affects the left side of the body, and vice versa. Imagine that suddenly you find it difficult to lift an arm or notice that a leg doesn't respond as it should. This sudden loss of strength, often accompanied by tingling or numbness, can limit basic movements such as walking, holding objects, or even maintaining balance. How to identify the symptom quickly? A simple and efficient test is to ask the person to raise both arms at the same time. Note, if an arm falls, this indicates muscle weakness. If you can't get up, this reinforces the urgency of the situation. The same can be done with the legs, asking the person to press or move one leg. If she is unable to perform the movement, it is a strong sign that something is wrong. Why does this happen? Interruption of blood flow in the brain prevents oxygen and nutrients from reaching the cells responsible for movement. With this interruption, neurons stop working correctly, causing loss of strength or control on one side of the body. What to do if you identify this sign? If you or someone close to you experiences weakness or numbness on one side of the body, don't ignore it. Call emergency services immediately. This symptom is a clear warning of a stroke, and time is essential to limit the damage caused. 2. Difficulty speaking or understanding, a stroke warning that should not be ignored. One of the most important signs of a stroke is a sudden difficulty speaking or understanding what is being said. This symptom, often subtle, can be mistaken for tiredness or distraction, but it is actually an indication that something serious is happening in the brain. What happens? During a stroke, blood flow to specific areas of the brain, such as those responsible for language, is interrupted. This directly affects a person's ability to articulate words, form coherent sentences, or understand what other people are saying. This condition is called aphasia and can range from mild to severe, depending on the extent of brain damage. How to identify the problem? Here are the most common signs. Slurred speech. A person may appear as if they are drunk or have difficulty articulating words. Difficulty finding words. The person tries to speak, but is unable to form complete sentences or exchange words. Inability to understand. Even simple sentences can seem confusing to an affected person. A quick test is to ask something simple like the person's name or what day is it today. If she hesitates, uses disjointed words, or doesn't understand the question, that's a clear red flag. Why is it dangerous to ignore? Difficulty speaking or understanding indicates that the brain is damaged, and the longer it goes without treatment, the greater the brain damage will be. Remember, a stroke not only threatens life, but can also leave serious consequences, including the permanent loss of speech or communication skills. 3. Changes in the face. Facial asymmetry as a sign of stroke. Facial asymmetry is one of the most obvious signs of a stroke. This symptom occurs when one side of the face appears droopy or unable to move. It is an alert that requires immediate attention, as it indicates that the brain is not functioning properly due to a lack of blood circulation in areas that control peripheral nerves. Why does this happen? When a stroke occurs, blood flow to parts of the brain is interrupted, affecting communication between neurons and muscles. In the case of facial asymmetry, the nerves that control the muscles in the face become impacted, making it difficult or impossible for a person to perform basic movements, such as smiling or closing their eyes in a symmetrical way. How to identify? A quick and simple test to check facial asymmetry is to ask the person to smile. Observe carefully. Crooked smile. One side of the mouth may not move or appear lower than the other. Difficulty moving the face. A person may not be able to frown or raise their eyebrows on one side. Asymmetrical eyes. One eye may appear closed or have difficulty blinking. These signs are clear and must be treated with extreme urgency. Why is it dangerous? Changes in the face indicate that the stroke is affecting critical regions of the brain responsible for motor control. The longer the brain remains without adequate blood flow, the greater the damage and the chance of permanent sequelae, such as facial paralysis. For loss of balance or changes in vision, a critical sign of stroke. Among the symptoms of a stroke, loss of balance and changes in vision stand out as important signs that indicate a medical emergency. These symptoms, although often less well known, can appear suddenly and indicate that the brain is suffering from a lack of oxygen and nutrients due to interrupted blood flow. 1. Loss of balance and coordination. Loss of balance happens because stroke can affect parts of the brain responsible for motor control and cooperation. This can manifest itself in several ways. Difficulty walking. A person may stagger, stumble, or appear disoriented when trying to move. Sudden dizziness. Feeling of vertigo, as if the environment were spinning, even though you were still. Lack of motor coordination. Movements that were previously natural, such as picking up an object or maintaining posture, can become difficult or impossible. These symptoms often appear suddenly and for no apparent reason, which is a strong indication that something is very wrong in the brain. 2. Changes in vision. Stroke can also cause visual problems, which can range from mild to severe. Blurred vision. Difficulty seeing clearly, as if the vision was cloudy. Double vision. Seeing duplicate images, which can make simple tasks such as walking or importing objects difficult. Loss of part of the visual field. In some cases, a person may not see in a specific part, such as the left or right side of the field of vision, without immediately realizing it. These changes occur because stroke can compromise areas of the brain that process visual information, located in the occipital lobe or in the neural pathways connected to vision. Why are these symptoms serious? Loss of balance and changes in vision are not only uncomfortable, but indicate that essential parts of the brain are being affected. These symptoms lead to dangerous falls, make it difficult to perform basic activities, and if ignored, allow the stroke to progress without the necessary treatment. The importance of early diagnosis. These are clear signs that the brain is in danger. Quick treatment can significantly reduce damage and even save lives. Sharing information about these symptoms is critical to helping more people consider a stroke and take timely action. Remember, sudden changes in balance or vision should never be ignored. These symptoms are the body's warning cry that something is wrong in the brain. Acting quickly makes all the difference. 5. Sudden and severe headache. A stroke warning sign that should not be ignored. A sudden and extremely intense headache can be one of the first signs of a stroke, especially the hemorrhagic type. Unlike a common headache, it comes on abruptly and is described by many as the worst headache of your life. Recognizing this difference is crucial, as it may indicate a medical emergency that requires immediate attention. What is a hemorrhagic stroke? A hemorrhagic stroke occurs when a blood vessel in the brain ruptures, causing bleeding, hemorrhage, in or around brain tissue. This hemorrhage increases pressure in the skull, impairing the functioning of brain cells and causing severe pain. This condition can be caused by factors such as uncontrolled high blood pressure, brain aneurysms, dilations in blood vessels, or head trauma. How to recognize a stroke headache? The headache associated with a hemorrhagic stroke has specific characteristics. Extreme intensity. It appears abruptly, with much greater intensity than a common headache. Location. It may be widespread or specialized in a specific area, depending on the site of the hemorrhage. Monitoring of other symptoms. Nausea, vomiting, mental confusion, blurred vision, or even loss of consciousness may occur along with the pain. Obvious difference. If a person already suffers from frequent migraines or headaches, this one will be different, more intense, sudden, and disabling. Why is the pain so intense? When blood escapes to areas of the brain where it shouldn't be, it irritates brain tissues and increases pressure inside the skulls. This excessive pressure causes overwhelming pain, which is the body's way of signaling that something is seriously wrong. 6. Generalized numbness or tingling, a sign of a stroke that should not be ignored. Stroke is widely recognized by signs such as weakness on one side of the body, but another important symptom is generalized numbness or tingling. Although less well known, this sign can be a clear indication that the brain is suffering. Recognizing and acting quickly when faced with this symptom can save lives and prevent permanent damage. What causes numbness or tingling in stroke? These abnormal sensations arise because stroke affects communication between the brain and the rest of the body. When blood flow to certain dedicated areas is interrupted, the nerves responsible for transmitting emotions can be harmed. This results in numbness or tingling, which can occur in different parts of the body. These symptoms do not affect the affected area of the brain, right or left side of the body. A stroke in one hemisphere of the brain usually affects the opposite side of the body. Face. Numbness on one side of the face can occur alone or along with other signs, such as facial asymmetry. Hands or feet. Some people feel tingling only in their extremities. Multiple areas. In more severe cases, the sensation of numbness can be generalized, affecting several parts of the body simultaneously. How to identify numbness or tingling associated with stroke. Regretful appearance. Unlike numbness caused by posture or nervous specificity, this appears unexpectedly. Specific location. It can occur on one side of the body or, more commonly, in bilateral areas, both sides. Accompanied by other symptoms. It may be accompanied by weakness, difficulty speaking, dizziness, or blurred vision, increasing urgency. A simple test is to ask a person to move or squeeze something with the affected area. If there is difficulty or a persistent feeling of numbness, this is a warning sign. Why should dormancy be taken seriously? Numbness and tingling indicate that the brain is losing its ability to control or interpret sensations from parts of the body. This interruption can be temporary and treated quickly, but it can leave permanent consequences if ignored. Quick action saves lives. If you spot any of these signs, don't hesitate. Call emergency services immediately. Don't try to wait it out or solve it at home. Every minute counts, and delay can result in irreversible physical damage or even death. Share this knowledge with friends and family. Knowing how to identify a stroke is a simple step that can save lives and prevent suffering. Information saves lives. Did you like this video? Leave your like, subscribe to the channel, and turn on notifications for more content like this. See you in the next video.